Hey, greetings. I have with me a really special guest today. This is Dr. Sandra Bloom, the author of Destroying Sanctuary and Creating Sanctuary and Restoring Sanctuary and um, and lots of other papers and outstanding work in trauma-informed care. Um, so I asked her to sort of share with us her thoughts about why we need to move our agencies towards this trauma-informed framework, why we can't stay in this old paradigm. And so she's been so gracious to join me today to talk for a few minutes about why we need to make this move.
That's great, Gray. Yeah, I'd be happy to. And it's nice to be with all of you. Um, it's so important because most people in the country, in our society, are going to experience a traumatic event at some time in their lives. And unfortunately, most people will have been exposed to childhood adversity, which, is a broad definition of what that means. That doesn't necessarily mean they were traumatized as a children, but kids often have very difficult lives. Families have difficult lives. And so the reason to really become trauma informed is to understand what all of that means. How did people's development get often derailed as a result of things that may have happened to them many decades ago? And they don't know any way to make connections between the past and the problems that exist in the present. And it's hugely liberating for any of us to know what is causing a problem that we're having. And the really big deal about what we now call trauma informed care, trauma informed services, is really about understanding causality. We now know that most of the mental health problems, most of the physical problems, most certainly pretty much all of the social problems that people are up against have their roots in bad experiences that often occurred early in development when they really needed some things that they didn't get or got way too much of what they shouldn't have. And we also now understand that these problems are intergenerational. So people pick up things that have happened to their parents and grandparents that were overwhelming, and it affects their ability to function now. And I think the really important part is it doesn't have to. People can get better from all this stuff. People can heal, they can transform trauma, they can grow post-traumatically. But you to begin that process, you have to understand where it came from, and that it's not about you being a bad person or a defective person. It's really about what's happened to you. And bad things happen to kids, unfortunately, to most kids. And we have to be able to respond then with that knowledge, which means all of us who are helpers have to acquire the knowledge. We have to really understand in our own lives and the lives of people we're close to and in everybody that we work with, how to ask the right questions, how to think differently and outside of the box about the problems that people bring into the circumstances that we're in. That's what really makes it so important. It shifts everything. It's kind of like, and you've probably had this experience, I know I have, of putting on, if you grew up and you didn't know that you had bad vision, you didn't know that everything looks really blurry, you just thought that was normal. And then you put glasses on and wow, the world looks entirely different. And that's what it's like to really understand this issue of trauma and adversity. It's really about putting on different lenses, and so many things that didn't make sense before start to make sense in our own personal lives, in the lives of people we know, and in the lives of people we work with and try to help. And that's, I think, what makes it such a big deal and why it is really so important. These are human universals. These are not, it's not about singling out specific people and giving them a diagnosis or saying that they're crazy or any of that stuff. It's really understanding much more than we used to about human nature and about what it's like to be a human being. And being a human being is not easy. And it never has been, but it's certainly not easy now. And it doesn't have to be as hard as it is. And I think the other really important thing that makes it a big deal, when you really step back and you really understand the nature of mental health problems, physical problems, and social problems, you really recognize that all of this is preventable. We really could prevent pretty much all of the suffering that is now in the world every day that people are dealing with. It doesn't have to be that way. We are actively making choices as human beings to perpetuate the kinds of things that create suffering. And we could stop that. We could make different choices. And I think probably the bottom line is that's what makes this so important, is that we need to make different choices. People should not be suffering the way they are.
Yeah, I think your example about your blurry vision, you think that's normal, and then you put on a pair of glasses and then suddenly everything seems different to you. I think that's such a great example. We've had some conversations with my colleagues about the ACEs. And I remember hearing about the ACEs in 2009, when I was in Yonkers attending a week-long training with you in Sanctuary. And I remember walking away thinking, this is like a great tool, but it's not the end all be all. Well, recently I've come across the ACEs Q, which is an additional set of questions like, in your neighborhood while growing up, did you hear gunfire? Were you bullied in school? Did you experience racism, in your community? And I think those are really important questions. So I think as we continue to put on these new lenses, we're going to continue to develop these tools, and we have to change from the organization all the way down. Otherwise, we won't really change suffering.
That's exactly right. Right.
It'll just continue.
Yeah, this is really big change that is actually not that hard to do, because it feels a lot better when you do it. It does. It feels better.
Yeah. And, one of the things that is a problem in domestic violence shelters, and I'll speak just to Kansas City, is when we give reporting data, the reporting data at the end of the year is how many hotline calls we took, how many people we entered into programs, how many hours of therapy we did. But at the end of the day, the real important data is, did we make anybody's life better? Were we kind? Were we just kind? And so we continue to ask the wrong questions because we continue to not put on the lenses, or we don't keep them on. We take them off again. I don't understand, once you put them on and things are clearer to you and they feel better to you, why do you take off those lenses?
Yeah, that's a really hard question to answer. I think, what keeps the whole thing going in place is that what you just described, that we keep looking at scoring up the pathology without really looking at, but are the outcomes better? And the outcomes can't be that we increase our number of visits or a number of hotline calls alone. The outcomes have to be that people get better. And once you see that people can do better, and not because you've made it happen, but because they have.
Right. They have to be the expert of their own lives.
Oh, absolutely. Then the ball starts to roll in a different direction. That's been my experience, that you take the lenses off again if the work is just so hard and you don't have any support. That's why it's so important that it be a whole organization, and ultimately all of our systems, because we're all embedded within really hurting and often very dysfunctional systems. Everybody is. So, but we do need prototypes. We do need organizations that will serve as prototypes for larger change. So we need a shelter that is a really healthy place where people who are victims of domestic violence stop being victims, don't victimize others, and learn how to have a healthy family. We need that. People need to see examples of how that's done. How does it happen? Because if you guys can do it in Kansas City, then we can do it in Philadelphia. Then it can be done in, East Japip. It can be done anywhere. If it can be done once, then it can be done again. So we need those kinds of prototypes to do that.
So in closing, if you were to give one piece of advice to a member of a small agency, whether it's an advocate, whether it's an educator, whether it's a clinician, whether it's someone who works in administration, what one piece of advice in regards to changing this paradigm would you give?
I guess I'd say the thing that springs to mind is learn to use a tool that evolved out of our work, which we call SELF. And it stands for safety, emotions, loss, and future. So whenever you're presented with a problem, ask you and the rest of your team, what are the safety issues we have to contend with? What are the emotional management issues that are getting in the way? What have we lost? And what will we have to give up to change? And why should we change? What do we want to get to? What's our vision of where we can go together if we do this hard work? And then just keep using SELF as a compass for change. It's an amazing, powerful tool that our patients really taught us.
All right. Thank you so much. Hey, hold on, Sandy. I'm going to turn off our recording here. Don't go anywhere. I want to say goodbye. Again, thank you so much for visiting to the staff at the shelter today and to my students. I really appreciate all that you had.
Great pleasure.